Hi everybody, so today's video is going to be all about prioritization, on how to solve prioritization questions easily. So this is the part 1 of the video. So first of all, while looking at the options, always scan what are the acute things, because acute is priority. Acute statuses and acute disease conditions, they're the topmost priority. And then look for something in the question that says new unstable patients or recently shifted patients, because assessment is one of the priority in the options we have to look for. And the patients who are recently shifted, newly diagnosed, newly admitted, wherever you see the word newly admitted, newly diagnosed, unstable patients and recently shifted patients, they are the ones who need assessment, and assessment is one of the priorities. Then look for unexpected things like unexpected signs and symptoms. And these signs and symptoms, they mostly begin with the word itch. So if you see hemorrhage, high fever, hypoglycemia, or the patient has no pulse, no breath, these are signs and symptoms which are of utmost priority, and we are looking for these signs and symptoms. So they mostly begin with H. Not to say that every time, but most of the times. Other than that, we'll follow the rule of ABC: airway, breathing, circulation. Always in the options, look for where is the airway compromised, and that is the first priority. Then we'll go for breathing, and then we'll go for circulation. For example, if in a question there's no sign of A, B, C, then we will look for signs and symptoms related to physiology of the body, physiological signs and symptoms, something that you can see first. Other than that, then we will go towards safety, pain, and psyche at last. Now, how these hints fit in a question very well. So for that, I need to explain you all of these things fitting in an example, and wait for the part 2 of this video where we will implement all of these said things, and I'll show you how these things actually work when you solve your questions. But other than that, coming back to the topic, things of low priority. So something which is of least priority, all the chronic conditions and expected signs and symptoms. So if you know the person has an infection, we know the person will have fever, and this is expected. So that is going to be the lowest priority. Other than that, chronic conditions like hypertension or diabetes mellitus and things like that, from which patient has been suffering since years. Those are the chronic conditions. They are of the low priority to us. So in the next video, I'll explain you with the questions how these things actually work. Thanks for watching.